Hi everyone, welcome to ResearchMD.com. Another great presentation today. We've been doing a series of lectures on endocrinology, and we covered posterior pituitary hormones first, and then we went into anterior pituitary hormones. We covered prolactin, we covered growth hormone, we went into extensively into thyroid. Make sure you watch these videos. Today we're going to get another big topic, adrenal gland. Before I go, just to introduce myself, my name is Dr. Pramil Cheriyath. I'm a physician practicing in the United States, program director, internal medicine residency, and transitional residency, and associate professor of medicine, two large medical schools. Okay, let's start. Let's start with adrenal gland today. Today, just our topic is just give you a brief introduction, general about an adrenal gland. Okay, and then starting tomorrow on, we're going to hit each one of those classes of hormones and go into very detailed the pathology and the physiology. Okay, so today is just a brief introduction. So I'm going to start with, again, my topic today is adrenal gland. So when we talk about adrenal gland, where does adrenal gland sit? That's what we need to know, right? Where does it sit? On top of the kidney, right here. It's a very small gland, maybe like, very small, 1 to 2 grams, that's all they have weights, okay? And but it had a lot of functions covering all over the body. So I'm going to look at the structure. So you got the structure, this is the adrenal gland. We just kind of blow it up a little bit. And then you have to look at, there's a cortex, and this is the blue medulla. Okay, 2 parts we have to know. So let's look at the cortex. What happens in the cortex right here? The cortex, you got zona glomerulosa, you got zona fasciculata, and then you got zona reticularis. The best way to remember GFR, glomerulosa, fasciculata, reticularis, mnemonic GFR. If you like mnemonic, that's pretty good, okay? Now, let's look at like what happens over here. I'm going to stand up here, that's probably better. So let's start to look at zona glomerulosa. The main hormone is produced is aldosterone, okay? It's regulated by angiotensin 2 and potassium, and the classes belong to mineralocorticoids, mineralocorticoid class, okay? Now, let's look at zona fasciculata, which produces cortisol, another big hormone, and it's regulated by ACTH and CRH, and glucocorticoid, the class it belongs to, okay? Zona reticularis, okay? Zona reticularis, what does it produce? DHEA, dihydroepiandrosterone, my friend. Okay, now what class it belong to? Androgen, and then it's regulated by ACTH and CRH. Okay, we covered the cortex. Now we have to go to the medulla. What do we have in the medulla? You got chromaffin cells. What does it produce? Epinephrine and norepinephrine. Epinephrine and norepinephrine. You know, they produce, it acts in the flight or fight stimuli, right? Class belong to catecholamines and preganglionic sympathetic fibers. Pretty much, this is the one that is like nervous system kind of regulated, okay? And so we have to know that. Now we understood the structure. You got the structure about the adrenal gland. Let's look at the regulation, what happens. So for that, we have to go back to the hypothalamus, the pituitary axis, okay? So again, we need to know this is an anterior pituitary hormone have influence on this, okay? So let's go back to the pituitary, and what happens, you got stress or circadian rhythm, hypothalamus produce corticotropin releasing hormone. And then what does it do? It stimulates the anterior pituitary, okay? Anterior pituitary produces adrenocorticotropin hormone. Okay, it's adrenocorticotropic hormone is produced by the anterior pituitary. Before going in the adrenocorticotropin hormone or ACTH, remember, it's the precursor is pro-opiomelanotropin. Okay, pro-opiomelanocortin is the precursor. That also produces endorphin and also produces melanocyte stimulating hormone. Okay, so it produces ACTH, and ACTH acts on the cortisol, or ACTH actually acting on the adrenal gland. Now, what does it do, the ACTH? And it produces, it stimulates zona glomerulosa, and it produces aldosterone, okay? It stimulates zona fasciculata, produce cortisol, okay? And what happens, the cortisol has the big negative feedback over here. If there is like increased cortisol, what's going to happen is like hypothalamus kind of get again inhibited, so less CRH and less ACTH. That's a normal mechanism. Okay, it stimulates zona reticularis, produce dihydroepiandrosterone. Okay, that's what it produces. Now, one thing you have to know is like the medulla. What happens to the medulla is actually secreted, you got nerve fibers coming from the brain, okay, go to the spinal cord, sympathetic fibers, and they go to the connected to the chromaffin cells, and that produce epinephrine, norepinephrine. So it's just a little bit different, okay? All the others kind of like ACTH kind of stimulates it, but this is pretty much coming from the brain. You got the preganglionic sympathetic fibers from the spinal cord, and then connected to the adrenal medulla directly, okay? All the other thing is kind of hormone. What does it work through? It goes through the blood, right? Just remember that. Okay. Now we just, we know how it works. Let's look at each hormone and just briefly, very briefly, like what are the functions. We'll start with the aldosterone, okay? So what happened to the aldosterone right here? The number one, regulate mineral balance, sodium reabsorption, potassium excretion. So what does it do? It acts on the kidney. You got the DCT and the collecting duct, okay? That is like, where does it get affected? And then what does it get? Sodium water reabsorption, and the potassium get excreted out. So you will have increased blood pressure, but you will lose potassium. There's hypokalemia, right? Remember, that's the main thing. It increases the blood pressure, but there is an involvement of the regulated by angiotensin 2 and the potassium. That's the regulator. What happened in the pathophysiology? You got excess, you got Conn syndrome, my friend, and then you got hyperaldosteronism, which is actually Conn syndrome, and then if it is low, you got a hypoaldosteronism, which will come back in detail. Don't worry about it now, but at least good to know what are the things, excess and the low. Now let's look at cortisol. There is again a mnemonic you can use. A big fig. Just remember that. The functions of the cortisol kind of briefly. So what happened? Appetite. It increases appetite, blood pressure, insulin resistance, and gluconeogenesis, and lipolysis, and proteolysis. Very, very important, okay? So what does it do? It go to the liver and produce like gluconeogenesis, stimulate gluconeogenesis. So you're going to have like a lot of glucose when you give steroids. Remember that, okay? So big fig. And what happened to fig? Fibroblast activity decreased, inflammatory immune response goes down, and decreased bone formation. So a big fig, remember that. Appetite decreases. All this thing increases. Okay, that's why when you give steroid, people are like usually eat, but they eat more. Blood pressure increases. You got insulin resistance increases, mainly think gluconeogenesis, lipolysis, and proteolysis. So there is going to be increased blood glucose, mainly acting on the liver. Now, what happened to the fig part? You got fibroblast activity decrease, immune response decreases. That's why this become an immunosuppressant drug. You can have like a lot of infections, right? We have to worry about that. And it also decreases the bone formation by stimulating the osteoblast activity, my friends, okay? So now, what are the pathology? Excess, it's like Cushing syndrome, right? Again, we're going to come back to it in detail. Don't worry about it. Low, you got adrenal insufficiency. Remember that, okay? Now, the next thing we're going to look at the DHEA, dihydroepiandrosterone. What does it do? The main thing you have to remember, I'm going to underline, it does not have any role in stress, okay? Just remember that. No role in stress. All the others kind of stimulated by stress. Prostate growth, masculine characteristics in males, and libido in females is also kind of related to. Now, pathology, excess, you can have like tumors, so remember that. Now, epinephrine or norepinephrine, we know the flight or fight activity in both of them, right? Let's look at the epinephrine. You got supports body's reaction to stress by increased heart rate, blood pressure, and the sugar. Blood sugar goes up. Norepinephrine causes the blood vessel constriction, plus increased heart rate, blood pressure, and blood sugar. Okay, now pathology, excess, mainly you have to worry about pheochromocytoma. So again, we're going to come back and teach you all about it. Don't worry about it. So I'm going to take a step back and look at our beautiful whiteboard right here. One more time, just what happened. Just go and look at the adrenal gland. Where does it sit? It sits on the kidney, top of the kidney, only like 1 to 2 grams, very, very small. Structures are right here. Okay, you got a cortex outside and a medulla right here. Remember the mnemonic GFR, zona glomerulosa, zona fasciculata, zona reticularis, okay? And you got medulla, you got chromaffin cells. This is the blue one, the medulla. And what hormones is produced? Zona glomerulosa, aldosterone, right? Zona fasciculata, cortisol. Zona reticularis, you got DHEA or dihydroepiandrosterone. And chromaffin cell produce epinephrine, norepinephrine. Okay, now let's look back at over here. Like what happened, the connection. Let's connect together. Again, anterior pituitary hormone, my friends. Don't forget it, okay? When you talk about anterior pituitary hormone, it produces, when there is stress or circadian rhythm, it produces first corticotropin releasing hormone from the hypothalamus. Where does it go to next? Anterior pituitary. And what does anterior pituitary produce? ACTH, which is adrenocorticotropin hormone. Okay, that's what ACTH is. Before we talk about ACTH, also always understand the precursor, which is called propiomelanotropin. Right here, actually propiomelanocortin, which also produce endorphin and melanocyte stimulating hormone, and ACTH can come from there. What does it do? ACTH acts on the adrenal medulla, and it pretty much acts on all this zona glomerulus, zona fasciculata, and zona reticularis. Okay. But this part is different. Remember, medulla chromaffin cell is primary ganglionic and it's like a nervous system involvement. Okay, all these three is by blood. The hormone go into the blood, ACTH and CRH regulated. But medulla, again, my friend, I'm just going to repeat it again. It's just by nervous system connection. You got nervous system from the brain, spinal cord. You got the preganglionic sympathetic fibers that stimulate the adrenal cortex and produce epinephrine, norepinephrine. Don't forget it. Okay. Now let's look at the functions right here. And aldosterone, again, sodium, water, reabsorption, excrete potassium. Remember, that's why they can have low potassium. Control the blood pressure. Remember, excess con syndrome, low, you got hypoaldosteronism. And cortisol, remember, a big fig, appetite, blood pressure, and insulin resistant gluconeogenesis all goes up, and fibroblast inflammatory and bone formation goes down, excess Cushing syndrome low, adrenal insufficiency, DHEA, again, remember, most important point, don't forget it, I'm going to repeat it again 1,000 times, no role in stress, okay? But prostate growth, muscular incontinence, libido is affected, pathology, excess tumors, and the epinephrine, norepinephrine, the flight or fight, we need to know, epinephrine support the stress reaction and increase the heart rate, increase the blood pressure and the sugar, norepinephrine, blood vessel constriction and increase the heart rate, increase the blood pressure and the sugar, and the pathology excess, we need to talk about pheochromocytoma. Thank you so much for watching. Please study really hard. It's very, very important to go back and find out the basic understanding how the hormones produce. Okay, but we'll be back tomorrow with another great presentation, and please support our channel. Thank you so much. God bless. Study hard, my friends.